I'd like to start by just acknowledging that in the last 7 months, 2 very close friends have passed away from cancer. Chip Chase was mentioned this morning already in a very moving tribute by Christian. I knew Chip since 1982. We started studying Chinese language together, and we influenced each other and taught each other ever since.
Sorry,
so,
the sound is not okay.
You don't hear anything?
Yeah.
Even with the speaker?
Really, really low.
Okay. I'll let you guys figure that out. Is that better? It's more clear?
A little bit better.
A little bit better, okay. And the other friend who passed, so as you heard, Chip was diagnosed in September and passed away early November. And 2 weeks later, my friend Michael Hook in Australia suddenly disappeared. And we heard that he just withdrawn from everything. And we heard 3 months later that he passed away from lung cancer. So we're talking about today about a problem that can be very difficult to deal with, very sometimes very aggressive disease. And it's important that we understand something about what our role is. What could I have done for my friends under those circumstances where they wanted to withdraw and just take care of themselves? That's very different than somebody in less acute circumstances who might want to come for treatment. So I'm not a cancer specialist, I'm not an oncologist, I'm an acupuncturist since 1982. I have also been involved in research for the last 20, nearly 30 years. Part of the reason I'm doing the lecture today is because I do have some useful things to say about, as an acupuncturist, what can you do helping somebody with cancer, but also because in the last few years I've been doing kind of what's called a kind of big data picture, looking at the evidence for acupuncture and summarizing that. And at the end I'll give you the citation for a paper that just was accepted and is currently in press, so you can go and download it in a few weeks probably. Looking at all of the evidence for use of acupuncture in cancer patients, and also looking at how healthcare systems around the world, how medical experts, how governments, government agencies have consumed that evidence, and how they have decided, well, the evidence is good, let's recommend acupuncture. And I want to present some of that evidence today. And I think I might dwell on it because I'm in the middle of it, so I apologize if I seem to take a long time. But I think it's important to understand where we do have good evidence so that you can talk reasonably about what's out there to encourage patients or encourage doctors. But also, I think given the rate of growth of this literature that I've been tracking, I would say that we're going to see demands for use of acupuncture in cancer patients really quite rapidly expand. So therefore, we as acupuncturists need to prepare ourselves in order to be ready to do those kind of treatments, to be able to interact with cancer patients, interact with oncologists, hospitals, etc. And I'm not an expert in all of this, but I do have some good suggestions about some of these things. Also, I practice Japanese acupuncture, and I'm guessing there's probably only a handful of you in here that would use the same techniques as me. So rather than focusing on, oh, in this case, do that. Needle this pattern, needle these points, do this technique. If I said that, you wouldn't know how to do it, most of you, because you've not studied Japanese acupuncture. So therefore, I'm not going to focus so much on, in this symptom, do this, in that case, do this point. I'll do a little bit of that. But I think it's more important to look at the principles. What it is, what are you dealing with here? What's the best approach? Especially when you've got really complicated cases with a lot of things going on. How do you handle that? How do you adjust your treatment? It comes back partly to what I talked about in the planner.